Welcome, everybody. I know some of you are still trickling in. Come on in, there's plenty of seating over here. We are very excited today to have with us HABRI, who is an amazing sponsor. Hopefully you've had a chance to talk with them and learn a little bit more. HABRI is the Human Animal Bond Research Initiative Foundation, and they're doing amazing things. And we have two amazing people here with us today to talk to you more about what those amazing things are and why they're so important. And I think everyone in this room understands the importance of the bond that we all share with our pets and can relate to this. So I'm pretty sure it's going to strike a chord across the room. Steve Feldman is the executive director. He just joined in January, and he's going to be leading the foundation forward and striving to really get awareness to it and put it out there. So please take everything you learned today and share it with the world, because it is immensely important. So without further ado, I would like to introduce Steve Feldman.
Before I start, let's just have a round of applause for Chloe and the entire BlogPaws team. They're doing an amazing job. And thank all of you for coming by our booth, for learning about HABRI. We're really appreciative of the time and attention that you've given to our important mission, which is what I'm going to talk about today. But before I do, I think I should tell you a little bit about myself. I love the smell of wet dog. Before you say, ooh, what is wrong with you? Let me tell you why. I hate to go out in the rain. My dog hates to go out in the rain, but we do. We have to. We walk, we exercise, and we sort of put up with it. But then, when we get back inside, even the oldest dog gets frisky and gets excited, and the nose goes under the towel, and pretty soon we are rolling around on the floor laughing, literally, and having the best time. And I get so happy, and I realized that he's happy and I'm happy, and it's because, and I associate the smell of wet dog with pure happiness. So it's magic. But I was talking to one of the scientists we work with, and he says, well, you know, Steve, magic is just science that hasn't been explained yet. Right? So what's happening? What's happening in his brain? What's happening in my brain? What's causing this feeling? And it turns out that when fingers meet fur, even wet, smelly fur, chemicals are being released in our brains: oxytocin, serotonin, dopamine, all the good stuff. And it has a profound effect on our mood and on our health. So I love the smell of wet dog, and that's why. So let me tell you a little bit about the Human Animal Bond Research Initiative. Our vision is to demonstrate that pets and animals make the world a better place, but we do it with science. Our job is to get widespread recognition for the science behind the human-animal bond, that humans and animals have this relationship, and that it's not just generally, doesn't just make you happy, it's very specifically good for our health. And so that's what we're all about. We're gathering and we're funding and we're sharing the research that goes behind those feelings that we have, and we're doing it in some very specific ways. Before I start, though, I want to tell you that these are the companies that started HABRI, and we're so grateful to them. Some of them are actually here, and so if you see PetSafe or Sargent's, I don't want to miss anyone, Morris Animal Foundation is here. These are organizations that help get this whole thing going. I mean, we all know it intuitively, but somebody had to put some money down, so if you see these guys, make sure you thank them. So in the middle is our mission, that pets and animals make the world a better place, and that we're going to use science to prove it. And so these are our strategic imperatives. This is kind of I want to make sure you understand what our foundation is really about. We're going to be leaders in research. We are going to be the place to go for anything you need on the human-animal bond, and I'm going to talk mostly about that. We are going to be the place where policy changes. We're going to reach government. We're going to, it's not just enough to have the science, right? You have to do something about it. You have to change the world. So that's what we're going to do. We're going to raise awareness And that's one of the reasons we're here today. And we need a strong foundation to do all of this. We got to raise money, we got to fund the research, we got to keep this mission going. So that's kind of what the foundation is all about. So let me just tell you a little bit about some of these specific resources we bring. We have a lot of scientific data and research. It's completely wonky, but it's the science behind what all of you guys are talking about all the time. We're a great cause marketing platform. If there are any exhibitors here, I guarantee you that if you talk about the human-animal bond, you will sell more products. We have widespread partnerships with AVMA and the Morris Animal Foundation and American Humane, and we want to be partners with many of you. We're a small foundation, but we can extend what we're doing by having more partners. So I really invite you to figure out how to be a part of that. And then government affairs. Again, government has policies that can help us or that can hurt us, and we need to be the ones to really act upon the science and change policy. So let me tell you a little bit about our specific research hub. It's called HABRI Central, habricentral.org. You see it right up there. We have over 20,000 articles. Everything you want to know about the human-animal bond is there, and it's all tagged and searchable. So if you know about somebody who's been really helped by an animal and they have a particular disease or ailment, chances are if there's a scientific paper about it, you're going to find it here. This has never existed before. I mean, the research on human-animal bond, it's in the vet school, it's in the School of Nursing, it's in the School of Social Work. It's all over the place, and we've put it together all in one place. Please use this as a resource. And it's, again, very wonky, but I guarantee you're going to find some good stuff there. So I really appreciate it if you would visit. So you'll often hear, well, yes, there's lots of stories, but there's not a lot of science. Well, it turns out we do have science in these 7 areas. For veterans and soldiers with PTSD, there's more than 100,000 of them, and there's plenty of people who've never served who also have PTSD, and they can really be helped by having pets and through animal therapy. I know this is BlogPaws, but did you know that the presence of a fish tank is really beneficial and helpful to people with Alzheimer's disease? So there's really good stuff out there that we want to share with people. Cardiovascular disease, I think it's intuitive to most people that if you walk your dog, you're going to have a healthier heart. But this one blew me away. There's a study out there that says if you have a cardiac event, if you have heart surgery or a heart attack, you are 4 times more likely to be alive 1 year later if you have a pet. So why aren't cardiologists prescribing dogs? Right? Okay, so you'll find a lot of really good stuff, especially in those 7 areas on the HABRI Central website, and I encourage you to visit. So I'm going to keep this going because we have a great speaker coming up in just a minute. We, this year, and we just put out the press release last week, it's still very fresh news, are funding $250,000 in new research. This is a list of the projects right here. And you can see that we're looking at autism both through animal-assisted therapy and with pets in the home. We're looking at dog walking and heart health promotion. We're looking at, and this last one kind of blows me away, equine psychotherapy for trauma survivors, and this is going to be a study at Oregon State University with victims of domestic violence working with horses. And so we're putting some real science behind this, and we're going to be giving away, a comparable amount of money for research every year. So we want you to talk about these things. Let me just keep going here. So, where do you come in? You are great storytellers. I mean, the science doesn't mean anything without the really moving and important story that goes with it. So if pets are a prescription for our health, you're the ones who have to fill in the blanks, right? That's what I want. That's why I'm here, because you guys are great storytellers. You do it every day. You have a tremendous passion. We're so grateful for that. And so we want you to fill in the blanks. If pets are a prescription for your health, then what's your story? How are you going to tell us that? How are you going to share that? And as a matter of fact, if you came by our booth, you know that we've been collecting cards and names, and we're going to give away a Fitbit. And here it is. Thanks, Tiara. We're giving this away shortly. And so Brooke and Tiara, if you didn't get your card in, they're going to circulate, and you can put it in, and we'll draw for this at the end. Because we're going to send you, every week, great human-animal bond stories. And you could choose to write about them or not, but we want you to learn about it. We want you to know about it. And so finally, I'll just say, you guys have an important part to play. This is how you can find us. By the way, I put my personal Twitter up there because I'm like 65 away from 3,000, and I figure you guys can help me there. But we hope you'll connect with us in any way that works for you, and we're really, again, grateful for you being here and paying so much attention. And so really, that's all I have to say. I just wanted to give you a quick overview, but it is really my pleasure to introduce Dr. Kate Hodgson. She's a great veterinarian and so much more. She graduated from Cornell University. She practiced mixed animal medicine and companion animal medicine for 10 years. She received her master's degree in family and community medicine from the University of Toronto with a focus on continuing medical education. And you're going to get an education this morning because Dr. Hodgson now works in both veterinary and human medical education. She's a medical education consultant for the Office of Continuing Education and Professional Development at the Faculty of Medicine at the University of Toronto. And a lot of MDs do this, but to have a DVM do this is pretty special. And she also does community veterinary outreach, bringing veterinary preventive health to underserved populations and creating bridges for public health. So we're so honored to be sponsoring this conference. We decided to bring in a keynote speaker for BlogPaws that's a real expert who has both practical and academic experience in bridging the gap between humans and animals. And so I want you to listen carefully to what Dr. Kate Hodgson has to say. She's going to teach us something. And then I hope you'll really tell that story. So I'm pleased to introduce Dr. Kate Hodgson.
Thank you, Steve. Wow. I am so happy to be with my people. I can't tell you how some days it is when I'm in the medical school and there's nobody who has a pet or gets it. It's like coming to the right planet. So thank you so much. Thank you tons to Steve and everybody at HABRI for having me. I'm nervous as anything, so you'll have to bear with me, but thank you very much for having me, Steve, because I have a lot of really important things that I want to talk about. In fact, what I'm hoping that after our morning, this bit of time that we have this morning, that you'll all better be able to do is I hope that you'll, and you all do, recognize the important role that companion animals have in many families. And I'm going to share with you some of the data that kind of looks at the different roles that families have in that pets have in different families. I'm also going to introduce a new term for you, for some of you, Zooeyia. I'm going to hope that you'll be able to describe the health benefits that pets provide to their human companions, which is what we call Zooeyia. And I'll share with you where that term came from and why it's so important. And finally, I want to explore ways to help all healthcare professionals, physicians, social workers, nurse practitioners, everybody, recognize the power of the pet effect and start by asking the pet query. I'm going to share with you the beginning of some research that we've done on that shows how powerful teaching physicians to ask the pet query is. So I want to start with my family. This is my great-grandmother and her dog, Oscar. So that is the oldest picture that I could find of pets in my family, because I don't think my family had any photographs taken before that. This is my mom with her Irish setter, Turk. This is my brother with Anna and Guinevere, who were named after the two most beautiful girls in the 8th grade. This is my husband-to-be with our dog, Maddie. This is my goddaughter with the family's cat, Hudson. This is the best kitten ever. I know everybody has the best at whatever it is ever, but this is the best kitten ever. This is my Taconic Belle. Look at that little, she was tiny. You could have carried her around in a teacup, and she's taken over the dog crate. That's where she is. That's where she is. She's taken over the dog crate. She was the more personality in 6 pounds than you'd ever, and she was only 7 weeks there. This is best puppy ever, Maddie Matterhorn. Dressed up for Halloween. I'm from Toronto, so I'm embarrassed by the Leafs too, but this is Maddie was a canine good citizen, and I worked with her in nursing homes in the Albany, New York area, and at Philadelphia Children's Hospital. So she was a canine good citizen and the best, anyway, my best dog ever. So, given that kind of a family background, I became a veterinarian. And I practiced for over 10 years in mixed animal practice and companion animal practice. And through my growing up and then my time in vet school and then certainly in the wonderful communities that I worked in, which were very diverse, I really believed throughout, but my belief became stronger and stronger and stronger that veterinarians were really the other family doctor. In the broadest, best sense of that, because I respect family medicine hugely. I really believe that veterinary medicine in the community is basically most of the time geriatric medicine in a pediatric patient. Because it's the complexity of the triangle of communication, but really challenging, complex, multiple diseases, what we call comorbidities. So and all the importance of preventative health care, but in that triangle of the patient not being able to speak and the patient only receiving care in the context of the family. Because that's one of the key things that you have to understand about family medicine. Patients only receive the care that the reality of their family can provide. And that doesn't mean, I'm not talking financial, I'm talking human resource, right? So anyway, so those are things that were really resonated with me and resonated more and more and more the more I practiced and the more I thought about this. And to me, the very best of veterinary medicine, and it didn't matter who you were taking care of, the very best of veterinary medicine is relationship and family-centered. And I realized, and I know there's at least one other veterinarian in the room, I realized, and a couple, I realized that when I went through school, and I loved Cornell, but when I went through school, I didn't get trained in all the complexities of family care enough. So after being in practice for a long time, and in many different types of practices, I said, I know somebody's figured this out better. I'm going back to school. And I got myself into a teaching program, into the Department of Family and Community Medicine at the University of Toronto. And I was in a teaching program, learning how to teach family medicine. So everyone else in the program were MDs, learning how to teach family physician residents, and then me, a veterinarian, trying to figure out what can we steal from family medicine and use in veterinary medicine, and vice versa. The more I got to it, the more I realized in the human-animal world, we knew a lot that they weren't using. So I started realizing there was a huge opportunity for bridging. So let me move forward. So let's get started. That's just a little intro. I wanted to share with you my family. So I wanted to start by talking about pets in the family and kind of giving you a context about pets in the family. What is a family? Family is not just a kinship group. And I think that's a really important way to be thinking about it. It's not just a nuclear family. And this is true for humans and multi-species. Family, and I love this definition. I almost put this definition up on my wall. You know, like people do embroidery things on their wall? Family is a group of intimates with both a history and a future. And that's a definition of family I can live with. I love that definition of family, because that meant that the families I took care of were families. So through all this time, both through my work and through my study, I really started to think more and more that pets can and have to be included in the family cycle framework. That's the way physicians are taught to think about families, not just individual patients. And by thinking about pets in a family cycle framework, it enabled a more integrated approach to healthcare, to all the best things about keeping us healthy. And it ultimately ended up improving, if we could do this, it ultimately ended up improving both pet and human health, which is crucial, because I'm not just thinking about making humans healthier, I'm thinking of making pets healthier too. So let's look at some data around pets in the family. You guys know this better than me. Over 62% of households have pets. This is from 2010, or have a pet. But I'm always thinking of extended families, because it's not just who lives in one house. It's all the people they're interacting with. It's grandma, it's the uncle, it's cousins, right? When you think about extended families, and this is where it gets powerful, guys. I mean, even more powerful. 75% of extended families have companion animals, which is amazing. We all know that. And so that works out to be, millions and millions of homes. This is a piece of data that really, when I teach family physicians about this is the piece of data that they talk to me about over and over again later. Children in North America are now more likely to live in the same household with a pet than with their biological father or a sibling. That is powerful. That is true. And that's the kind of information that really helps people like nurses and social workers and doctors kind of get their heads around, what does this really mean? Kids are more likely with a pet than with their dad. In Canada, and this I think is also very significant, in Canada, and this is data that was done in 2009, in Canada, 15% of households intend to adopt a pet in the next year. So it really is growing, growing. Why? Why is this increasingly important role of pets in families? I think there's a ton of contributing factors. This obviously needs to be looked at more. But just to give you a quick sense, some of the things that have been talked about and studied and that I agree with are increasing urbanization and suburbanization. Really, there's a huge need for us to be with animals and nature, and pets provide that. It's called biophilia. Geographic separation of traditional human families. We used to grow up closer to our extended family, and often, my family, my brother lives in New Mexico, my mother lives in New York, and I'm in Canada. Anyway, and another thing, and there's been some really interesting research on this actually coming out of places like South Korea, need for live interaction in an increasing technological world. And I have to take my hats off to you guys, because you've figured out a way to have both. But sadly, some of the people, and I'm talking about the increasing rise of what we call internet addiction, some people, young people, all ages, but they're not interacting with anything live, human or animal, because they're so addicted. And in fact, in South Korea, for example, it's a real issue, internet addiction. Just surfing endlessly. We need to do more studies of this. But there's one great study that was published in Social Work in 2006, and they interviewed over 5,000 families at the Four Corners area in the southwestern, right close to here, Four Corners area of southwestern U.S. And what they found was that although different cultures have different incidences of having pets in their household, across all cultures, when you ask them, what does that pet mean to you? What's the role? There was almost no difference. Over 90% of everyone who had a pet, even though the way the pet lived with them differed, everyone described receiving emotional support from the pet, unconditional love from the pet, companionship from the pet, and really considered them a member of the family, even though in some families the pet slept on the bed under the covers, in some families the pet was in the kitchen, and in some families they might have been outside. Even so, they always describe the huge impact that the pet had on that family. So it's another thing we could talk about for a lot. And to make it even more complex, there are multiple, and you guys know this, there are multiple roles of pets. Pets can complement family structure and the developmental stages of a family. Sometimes pets are a child, kind of. Sometimes they're more of a partner or a companion. And sometimes that changes. Sometimes that changes, and that's wonderful. That's okay, right? And allowing that change to occur is part of the wonderful fabric of life. Pets can sometimes act as replacements for family members. And sometimes that's amazing and it augments the family structure. And sometimes it can interfere with family dynamics. And that's something, too, that's often an evolving thing. So it's complex. So, given this kind of a background and giving this kind of a, being trained as veterinary medicine, but then trained to teach family medicine, I was very much looking for kind of a friends. I was looking for friends. And have you all heard of the One Health? Have you ever heard about One Health? The One World, One Health, One Medicine? Well, that is kind of an approach to thinking about the way we could move forward with healthcare around the world. So health is a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. So that's, I think, an important thing to think about. We're not just talking about not being sick, we're talking about being well, okay? And One Health is dedicated to integrating and improving the lives of all species by integrating the work of human healthcare providers at all levels and the animal health veterinarians, but everyone involved in animal health together. So it's about integrating human health and animal health to improve the lives of all species. So you can imagine when this kind of was being articulated more and more and more, I was like, whoa, finally someone's put a name to what I wanted, what I do. This is awesome. I gotta find out more about this. And tons of stuff is happening at One Health at the international level. WHO, the CDC, governments, bioterrorism, preventing bioterrorism, et cetera, et cetera. And I respect my colleagues who work there, but that's not where I work. And there's a lot of work that's done at this kind of preventing diseases and stuff at the provincial or state level. Again, very, very important, but not where I knew it needed to be. I really focus on integrating human health and animal health at what I call Main Street. Because that's where everybody is. That's where all the 85% of the healthcare providers, both veterinary and human, are there. They're in the communities, they're on the front lines. And if we can't make an important initiative like One Health matter there, then it probably isn't going to impact the actual people enough. So I'm really focused on One Health in the community. How can I integrate that at that level? And there's tons of opportunities for One Health to improve the health care for individual patients, animal and human, their families, and the community, and to really ensure that this kind of One Health approach is part of what we call primary care, that it's integrated across the board. So that led me to define a term, because I found in my work with physicians that when I said things like human-animal bond, they thought I was a crazy cat lady, which I am. I am a crazy cat lady. I'm a crazy dog person too, so I don't know. I'm one of those ones as well. But don't dismiss me. Don't dismiss me because you think I'm a crazy cat lady. Listen, I know that. So anyway, I found that it helped if I created an official sounding term. So Zooeyia. And when I talk about Zooeyia, I really try to make it clear that it's an essential component of One Health. So One Health is not just the prevention of zoonoses, and that's where a lot of the conversation is right now. Preventing zoonoses, preventing bioterrorism, preventing the next H1N1 outbreak, okay? But it's not just that. So zoonoses are the diseases, zoo, animal, noces disease, the diseases that humans and animals share. H1N1, SARS, ringworm, et cetera, right? But it's not just that. The human-animal bond is, I believe, and will always believe, the foundation of what we're really doing, even though we didn't know what to call it, One Health in the community. And Zooeyia, zoo from animals, Eia, health. Zooeyia. Isn't it awesome to have something to call what we've been talking about all these decades? Zooeyia is what I call the positive inverse of zoonoses. I'm not a glass half empty kind of person. I'm a glass half full, if not overflowing kind of person. So I'm a Zooeyia kind of person. I'm not a zoonoses kind of person, although that's obviously part of having healthy families. So Zooeyia is the human health benefits that animals and humans share. And in my mind, it's really the evidence base for the human-animal bond and a One Health integrated approach in the community. That's what Zooeyia is. So examples of Zooeyia are many. You could talk about animal models for medical research, animal therapy, animal-assisted activities. But what I really focus my conversation on, because it impacts the most people, is human health benefits that they share with their companion animals, okay? So animal therapy, just so that we're all kind of got definitions, because I think it always helps to have definitions. Animal therapy are structured encounters when a therapist uses an animal as part of a treatment plan, and the therapist is often owns the animal, okay? Then there's service dogs, and we're increasingly seeing service dogs being used. They're trained dogs for the visually hearing impaired, children with autism, seizure alert dogs. They're dogs who've been trained but then placed in the family. So that's kind of a category. Then there's animal-assisted activities, and those are defined as brief visits, usually an hour or so, with animals in a variety of settings. So bringing animals into nursing homes, hospitals, schools, prisons. Although sometimes now in nursing homes, we actually have resident cats and things, which is great. But again, the animal here is often, so my dog, Maddie, I was definitely doing animal-assisted activities when we went to the Children's Hospital, my canine good citizen. But again, the animal's not owned by the family so much, right? They're not embedded in the family. Oh, another great example that we're seeing more and more of animal-assisted therapy is bringing dogs into university exam weeks and having a puppy playroom. Such a good thing. Kids, listen to me, how old am I? College students are really having a tough time. The stress they're facing is incredible. And I know of multiple universities that have done this, incredibly strong work coming out of Nova Scotia, Dalhousie on this, for example. But what I want to focus in is opportunities for Zooeyia of the companion animal living with their family. And time check, oh my gosh. And I want to really talk about 3 big categories of opportunities for Zooeyia in families. The first is that pets can be catalysts for harm reduction. An example, and I'm going to show you some data on that, is pets being catalysts to stop smoking or control the smoking. Unbelievably powerful. I'll come back to that. Second big category of Zooeyia in the community and families is that pets can be motivators for healthy lifestyle and lifestyle choices, lifestyle behaviors. For example, and Steve introduced that, the increasing exercise. And finally, and don't overlook this one, pets, your own pet, your own, not officially trained pet, can be a therapeutic intervention, can be a treatment, sometimes better than taking a drug, or certainly a good additional thing to treat an illness such as managing stress, anxiety, or depression. Wow. So let me go through with you just a little bit of the data, some evidence around those. Look at pets as catalysts to quit smoking. So you guys know, but if you could get this word out, it would be really good. Pets are terribly affected by secondhand smoke. They're really canaries in the gold mine. Cats get oral cancer because they grooming behavior, totally natural, but a cat in the home of a smoker has almost 14 to 15 cigarettes worth of toxins in its hair. So of course they're grooming, and what happens? Those carcinogens and toxins are in its mouth. And so we know that cats get oral cancer, but we also know that there's an increased association of lymphoma and mammary cancer from cats. In dogs, they too are very affected, and you know what? No kidding, it depends on the kind of breed. Our little brachiocephalics with their squished noses, they get lung disease because their noses aren't there to clean out the toxin. And what about our long collies and our Shelties and our long-nosed guys? They get nasal cancer because they do have a nose that cleans out the toxins. So anyway, we all know that. But when you tell a pet owner that, it turns out, and this was an incredibly powerful study that was published in a journal called Tobacco Control. When you tell pet owners about the dangers of their pet being exposed to secondhand smoke, it turns out it's an incredible catalyst to quit smoking, to attempt to quit smoking again, because as you know, it's hard and you have to encourage other members of the home, of the household to quit smoking, and this is a win, folks, to prohibit smoking in the house or in the bedroom or around the pet. And what was really powerful, kind of sad, but powerful, is that people were way more motivated to control their smoking behavior to protect their pet than they were to protect their wife. And they asked this, but they would do it. No more smoking in the car, Those are all really powerful changes to make, even if you yourself can't quit all the way. And it's a huge, because one of the things about smoking, anyway, I don't want to go into it, but addiction specialists, it's very hard to find the motivator. And once you find the motivator, the person can start a path of behavior change, but you have to find it. So anyway, so one of the implications of this study was that veterinarians and the whole animal health community is a broad new base to support and supportive healthcare professionals and voice to help control this kind, to help people be catalyzed to control their smoking, and that it was of particular significance. In fact, the only thing you could probably talk about with people who lived alone with a pet. It was the only thing. In fact, they lived alone and were becoming more and more socially isolated. Couldn't go to the bar, couldn't go out with people and so this was one thing that you could kind of maybe get them to think about re-engaging on a harm reduction behavior, what we call harm reduction. Okay, and in fact, some health units are actually using, this is a homemade poster that one health unit put together. Okay, so let's quickly talk about motivators to increase physical activity, and this has been studied and is being studied more and more. Ppat says motivators to increase but to sustain physical activity, and that be the holy grail, people. It's not just waking up January 1st, I'm going to walk every day. It's sustaining that all the way through to the next, for a whole year. Particularly important with kids, and there's some great research on that. All these papers, everything I'm talking about, guys, is on HABRI Central, okay? So a great study that was published in the Human Journal Obesity was called the Ppat Study, and it looked at obese people and obese pet partners. And they put them into basically a walking program. And so increasing activity, and the majority of the activity was around walking and being with the pet. And what they found was, the pet people partners did exercise more, significantly more, and what in the human medical world is the holy grail, they sustained it for over a year. This exercise buddy partnership kept on going. They had really just plain established a new way to live, a new amount of exercise in their daily life. Very powerful study. There was another study published in the Journal of Preventive Medicine where they tried to kind of explore why. Why is there this powerful difference? And you guys all know this. The dogs actually initiated wanting to go exercise, unlike my best friend who's like, oh, it's raining. And dogs actually added enjoyment. And what's really kind of important, we know it, but you actually had parental pride walking with your dog. You're kind of like strutting it out. I might look like terrible, but my dog is gorgeous. So, and again, I want to emphasize how important this kind of integrated approach is with children, and I think huge opportunities in communities to actually do this, whether it be in church basements or whatever. This will keep kids engaged. And then finally, I want to talk about that third big category, which is pets as therapeutic inventions, what I call the pet effect. Pets provide attachment, they help us with emotional well-being, social well-being, and they're hugely impactful on decreasing feelings of isolation, which are an underlying component of a lot of mental health issues. So pets have been, and the wonderful studies have been used to address the isolation of chronic disease and to help manage a myriad of psychiatric illnesses. And I don't have time to go into big detail, but lots of examples: ADHD, autism, even maintaining activities of daily living with people with dementia and Alzheimer's. Amazing, amazing data on the effect of pets with anxiety and depression, as all the way up the spectrum to post-traumatic stress syndrome. So, I mean, it's amazing. when we looked at this and actually tried to measure, not me, I didn't do this study, but people have looked at this and actually tried to measure what's going on with your cortisol, what's going on with your blood pressure, like are there physiological parameters we can measure? What they found in this study was that PATs really were incredibly effective, and when they tried to explore why in keeping blood pressure down, keeping cortisol levels down, keeping all the measures of stress down, PATs provide, when they say why, they found that PATs provide, and this turns out to be what's probably key, non-judgmental social support. They love us even when we look and they love us more when we smell bad. And it was that because in these studies, and there's been a myriad of them, when they compare a pet versus a person, even your like a family member, there's the patient sometimes perceive that even a human family member, best friend, is maybe judging them, but the pet never did. And that seemed to be a really crucial part of really feeling embraced somehow. So anyway, so that was part of the buffering of what we call pathogenic responses to stress. Time check. So these kind of examples of pets having an effect on the pet effect, pets actually being therapeutic interventions, really applies, and the more research we do, the more we know it applies across all what we call the diseases of greatest burden. So the diseases of greatest burden are the ones that affect a lot of people, make you really, really sick, and cost a lot, both in healthcare costs, but also in family integrity costs. And those diseases are cancer, musculoskeletal disease, cardiovascular disease, diabetes, neuropsychiatric diseases, and respiratory diseases. And when we think about all those diseases of the greatest burden, and we think about the risk factors, so the risk factors to get those diseases are physical inactivity, obesity, tobacco and alcohol use, hypertension, barriers to the activities of daily living, and social isolation of chronic disease are basically the risk factors that contribute / cause the diseases of the greatest burden. Pets have a positive effect on all those risk factors. And that's a message that we need to have go everywhere. Right? The smartest thing you can do is invest in healthy pet relations, healthy pet-people relations. That's the kind of thing. So I think that, as Steve was saying, you guys, there's no one better than you all to tell stories. But I'm going to suggest that there's an opportunity for you to share the evidence as well. And I call it the evidence for Zooeyia, which is all on HABRICentral.org. Because what I've found, and I've beat my head against the wall quite a lot and gotten really discouraged sometimes, is if I don't back it up with the evidence, it doesn't resonate unless I'm with my people. My people. Right? So that would be my thought. It's so easy to get... say, hey! It's so easy to get, my people, my pet people. So it's so easy to do it, and I'm just suggesting to you that when you do it, it makes your story that much more powerful, right? So just a thought. What I'd like to move on to now, and I'm checking time. I have a bit of time. I know, guys. I'd like to move on really quickly to telling you about what I have figured out probably has to be the very first step to making this kind of thing a reality, of really integrating human and human health and animal health. And that's to teach everybody to ask the pet query. What's the pet? So to practice One Health and to activate those opportunities for Zooeyia, you need to know if there are pets in the family. Like that's the start, right? And human healthcare providers are unaware, and I'm going to share with you some studies, both personal surveys that I've done, but also the literature, are unaware. They just don't know whether their patients have pets, and they don't ask. There's a whole bunch of reasons why they don't ask, but they don't know and they don't ask. In fact, we did a study in 2011, myself and a doctoral student, and we asked a group, a sampling of family physicians and nurse practitioners, how many patients did you ask about before we ran a workshop for them? And so we were asking, what were you doing before the workshop? Then we gave them a workshop, and then we measured what they were doing after, giving them a little bit of teaching. Between 0 and 25% asked anything about pets to the patients. They had no clue. No clue. And I've done other studies that confirm that. Only about, very rarely do you have, it's less than 20%, do physicians or other healthcare providers have any clue about the pet ownership status of the people they're taking care of the families they're taking care of. So they don't know. So what we did is we taught them to ask the pet query. The pet query is a communication tool to help integrate animals and pets into the patient, the human patient's comprehensive health and family history. So teaching the doctors how to ask what we know is a crucial question in 2/3 to 3/4 of families, right? And we really teach it that it's part of every patient's history. You can do it at initial intake when the patient's coming to your practice. You could do it at what we call the periodic complete health exam when you're going in for your yearly checkup or whatever. Or if you ever have an index of suspicion about anything, and disease. And this is the pet query. Could not be simpler. Are there pets in your extended family? If the answer is yes, ask how many, what species, and then get the veterinary contact information. If the answer is no, no harm, no foul. And this is so much easier a question to ask and so much less intrusive than a lot of the things your healthcare provider asks you. How many sexual relations have you had in the past year? Like, that's a kind of an alien. This is actually what we found is it's a very positive, it's a very strong, it's a very empowering question. So we did a tiny, tiny little trial, really just to show proof of thought. 33 nurse practitioners and family physicians. We got baseline data. We did this little workshop. It wasn't long. It was like an hour and a half, and then we followed them up 5 weeks post. What we found after the workshop was how many people, how many patients were you able to start asking about pets 6 weeks after the workshop? We had taken it from almost 0 to 75 to 100%. Now, of course, if someone comes in asking about cardiac chest pains, you're not going to take time to, you'll deal with that later, right? You deal with if it's an emergency and it's an emergency. But in general, they were able to include the pet query in over 3/4 of their patient encounters. That's pretty good. And 100% identified that it was clinically relevant to ask patients about pets and contacts with animals, because they were able to then use it to do things like encourage more exercise, address family dynamics, talk about smoking, et cetera, et cetera, et cetera, et cetera. So it turned out it was a hugely powerful, the results for them was like, oh, wow, there's good reasons to do this. And when we asked them how feasible was this, they said, it really was easy. It was really easy, because if the answer is no, it took me 2 seconds and I didn't upset them at all. It moves on. It's not important to them. If the answer is yes, oh my gosh, it opened the door. I had a doctor come up and say, I've been taking care of this family for 15 years. And I tried to connect with them, and I asked this one question. I know more about this family than I knew for 15 years. I know everyone who's in the house. I know that they're worried about their teenage son. I know that grandma might have to come live with them. I know more about their socioeconomic situation. I even know if they have a backyard. One question worth more than 15 years of trying to connect with my patient. So it enriched the patient history. You got a much better understanding of the patient situation, helped them make a diagnosis. I suddenly have the other pieces of the puzzle there. And it enhanced the therapeutic plan options. I felt like I had other things I could include in how to manage whatever the illness was. Better sense of home life, greater insight, reveals the patient's family context, which allows us to what we would call assess social capital, social capacity, is a kind of formal words for this kind of thing. Understand your patient is what we're talking about. And we did not expect this, but I have to tell you, this was the most powerful part of the study for us because it's the what's in it for them. It turns out it's one of the best catalysts to strengthen the patient-physician therapeutic alliance, which is at least a third of successful outcomes. If you trust your doctor, if you feel your doctor knows you and cares about you, you're a third more likely to get better. And if you distrust your doctor or feel he didn't really listen to you, or he doesn't really understand what you're trying to say, even if he's right with the drug he's prescribed or the test he said you had to go get, you're still less likely to get better. This question, if the answer is no, 2 seconds. If the answer is yes, probably one of the most insightful insightful understanding and building of a therapeutic alliance. And frankly, if I can have therapeutic alliance, I'm happy, So, medical schools, since we've done this little pre-pilot, both medical schools in both the US and Canada have approached us, but we need funding. We have to have funding for this. So if anybody knows of ways we can access funding so that this can be integrated and then studied, we need it. So what is your role? You guys, the experts, you are the experts. To do what you do so well, to communicate, to recognize, communicate, and help others recognize the important role that companion animals play in many families. And I bow to you all because you are the best at that. You guys own that. You are it. But is there a role for you all to describe using Zooeyia evidence when you can, HABRICentral.org, to describe the health benefits that pets provide to their companions and use the Zooeyia? Amplify your message by referring to Zooeyia. And finally, can we help find ways to help all healthcare professionals recognize the power of the pet effect and to ask the pet query? Because I think I have to tell you, that's the next challenge, people. So I'm done. Steve, I know you have a prize to give away, so that's awesome. Okay, so goodbye, everybody. Thank you.
That was great.
Okay.
Dr. Hodgson, that was fantastic. Thank you. Kate and I are going to stay up in the front of the room. If you want to come up after we're done, and we'll be happy to talk with you and answer questions. And ask Tiara to come up. I'm going to hold the bowl. You pick. We're going to pick thank you for signing up for our newsletter. Hopefully it's useful to you. And we're going to give away the Fitbit. Okay? we've got Rosalind Acero. Rosalind? All right.
And before we officially wrap up, we have one thing that we would like to, Steve, stay here, please. So obviously BlogPaws is all about HABRI, and we definitely support this. So we just want to present you with a little donation on behalf of kind of everyone in this room, because you all come here for this.